I'm Dr. Charles Dactus. I'm an interventional pain management physician here at Spine and Pain Centers of New Jersey and New York. I did my fellowship training in interventional pain management at Harvard University's Brigham and Women's Hospital in Boston. And prior to that, I was at Albany Medical Center for anesthesia and neurosurgery. Welcome to my video series on interventional pain management technique. I hope over the course of this series, we get to understand pain management techniques and how they can help to restore your function and restore your quality of life. I look forward to seeing you and working with you. Hello, I'm Dr. Charles Dactus. Today I'm going to talk about spinal cord stimulation trials. Spinal cord stimulation is a technology that can be brought to bear upon individuals that suffer from neck and upper extremity pain, or low back and lower extremity pain, as well as other diagnoses which can be discussed on an individual basis. What is spinal cord stimulation? Spinal cord stimulation is the placement of a small electrode within the spinal space that sits on top of the coverings to the spinal cord and spinal nerves. The technology delivers a microvolt current to the spinal cord to block out pain signal from getting to the brain. This allows the individual to be able to function, run, work, play with very little discomfort and restoration of the function. Who's a candidate for spinal stimulation? Individuals that suffer from neck, low back, upper extremity, lower extremity pain, individuals who have undergone spinal surgery and have persistent symptoms afterward, or individuals with vascular disease in their upper or lower extremities, and certain individuals with refractory angina or chest wall pain due to cardiac problems. How is the spinal cord stimulation trial performed? It's done in a room very much like the one I'm sitting in, on a table much like the one in front of me. The individual is brought to the suite and placed on their stomach. They're monitored from a cardiac standpoint, blood pressure standpoint, as well as with a device called pulse oximetry. And they can be sedated, but the technique is very benign and can be done under a straight local anesthetic. I'll use this model of the low back lumbar spine to demonstrate how the electrodes are placed. The individual is laying on their stomach. A needle is placed into the space on top of the coverings to the spinal cord and spinal nerves after the skin is anesthetized. Through the needle, a small electrode is threaded through the needle and placed on top of the appropriate portion of the spinal cord. Once I'm happy with placement of the electrode, the device is turned on, and the individual will feel a pleasant tingling sensation into the affected extremity or portion of the body that we're trying to cover. Once I'm happy with coverage and the patient's happy with coverage as well, a specialized dressing is applied and the individual is transferred to the recovery area. In the recovery area, we will go over the device itself, we will go over how to program the device, and the individual will then be sent home for between 3 to 7 days. I will generally see the individual back in about 7 days and will pull the electrode from their back. Don't worry, it doesn't hurt coming out. After the electrode is removed, I'll sit with the patient and their family to determine how effective the device was. Our literature would suggest that 50% reduction in symptoms is acceptable for a permanent implantation of this device. I like to see at least 50%, but it's better if we see 70 to 90% reduction. Once we make a determination that the individual is a candidate for permanent implantation, we can then go to the next phase of this device, and I'll cover that in a future video. What are the risks of spinal cord stimulation trial? Well, the needle stick itself can cause irritation to the skin, infection, slight chance of bleeding. Once the needle gets near the spinal canal, we can develop what's called a spinal headache. This is a very rare problem and can be treated quite easily if it occurs. Irritation to the nerves or damage to the nerves and spinal cord is theoretically possible with any spinal procedure, but is quite unlikely with this technique. Overall, this technique is a very safe technique and incredibly potent in restoring function and the ability for an individual to live a fulfilling life without pain in the back, neck, upper or lower extremities. Thank you very much. I hope that you learned what needed to be learned from today's presentation, and I look forward to seeing you in the office.